Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, duodenal ulcer, treatment of bleeding duodenal ulcer. The complication of duodenal ulcer is bleeding duodenal ulcer. So, how are we going to treat the bleeding duodenal ulcer? So, for the bleeding duodenal ulcer, the first important priority of the bleeding duodenal ulcer obviously is to control the bleeding site. And then you should do an endoscopy, and then you do an endoscopy and identify the bleed source of the hemorrhage. Okay, what is the source of the hemorrhage is identified, or source of bleeding is identified with the help of the endoscopy. Now, in the endoscopy, if the source of the bleeding is gastroduodenal artery, which is actually the most common source of bleeding in a duodenal ulcer, in such case it can be controlled by placement of a suture ligatures. You will easily control the bleeding by just putting some sutures over the artery. So if this is the bleeding artery, you put the sutures and you stop the bleeding, right? But if there is a case where the endoscopy is done but you are not able to identify the source of bleeding, okay, that means endoscopy has failed to identify the source of bleeding, then what do? Then we have to do a pylorodiodynotomy is done. Okay, we will have to open it. It's simple. You will have to do an open procedure. You will have to open the duodenum or the pylorus, and then you will have to visualize, or you will have to inspect. You will have to open the duodenum, and then you will have to inspect the duodenal bulb and gastric antrum for the bleeding. Okay, and then obviously based on the bleeding artery, you will put the ligatures. Now, after resolving the bleeding, then you should do an acid reducing operation is done. Acid reducing operation is done, number 1. Right, acid reducing operations, most probably we can do a truncal vagotomy, can be done in this procedure. In this, okay, actually if you see, almost 40 to 70% of the bleeding duodenal ulcers are actually positive for 40 to 70% of bleeding duodenal ulcers are positive for H. pylori, number 1. Then H. pylori testing, if it is done in the acute hemorrhage, if you have done a H. pylori test in acute hemorrhage, the patient is having bleeding, and now if you do an H. pylori test, this is not reliable, because obviously the patient is bleeding, so you cannot easily identify the organism, because even with the Campylobacter like organism test, which is CLO test, which is available, and even with this test you have some false negative results are also seen. False negative rates of around 18% is seen if the patient is bleeding. Okay, now second, if an acid reducing procedure is not performed, think that an acid reducing procedure or truncal vagotomy is not performed, then 50% of those patients have increased risk of bleeding. So 50% have increased risk of recurrent bleeding. So because there is increased risk of recurrent bleeding in 50% of patients, it is better to do a truncal vagotomy. Okay, so for acid reducing operation, preferably a truncal vagotomy is always done in this procedure. Next, so overall, if we have to see, if you were asked a one liner, the truncal vagotomy with pyloroplasty is the most frequently used operation for bleeding duodenal ulcers. So for bleeding duodenal ulcers, truncal vagotomy with pyloroplasty is the most frequently used operation.
Thank you and thank you for watching.